So this is the topic for today, importance of exercise as a modality for well-being. I'm really excited and honored to introduce our speaker for today, Dr. Sheela Nambiar. She is an obstetrician and a gynecologist. She's the president of the Indian Society of Lifestyle Medicine. She runs her own clinic in South India. She's a lifestyle medicine physician, a best-selling author, and a passionate advocate for women's wellness, fitness, and positive lifestyle change. Dr. Nambiar is a graduate of Madras Medical College and Kasturba Medical College, Manipal, graduating as a gold medalist from the latter. She's board certified in lifestyle medicine from the British Society of Lifestyle Medicine. She's a fitness consultant and also holds a certificate in positive psychology from the University of Pennsylvania. She's passionate about women's health and enables their empowerment through the practice of gynecology, lifestyle medicine, fitness, and counseling for positive behavioral change. She is a founder member and the current president of the Indian Society of Lifestyle Medicine, an advisory board member of Lifestyle Medicine Global Alliance, a council member of the True Health Initiative, an advisory council member of the World Positive Health Institute, a board member of the Asian Lifestyle Medicine Council, and is on the editorial board of Lifestyle Medicine, the Journal of the British Society of Lifestyle Medicine. She is also a speaker at TEDx and other national and international forums and conferences, as well as running her own wellness program for women called Training for Life. Dr. Nambiar is also an author of 3 best-selling books on fitness, exercise, and holistic well-being, namely Get Size Wise, Training for Life for the Indian Woman, Gain to Lose, an essential guide to losing fat by gaining muscle, and Fit After 40, for a healthier, happier, stronger you. She currently writes for the Rotary News magazine, and she's also written for one of the national newspapers on various topics related to health, fitness, well-being, lifestyle, and behavioral change. Dr. Nambiar, very warm welcome to you from the Institute for Population Health and Weill Cornell Medicine-Qatar. Over to you.
Thank you so much. Thank you. I'd like to thank you as well as Dr. Mamtani for inviting me here today to talk about this subject that I'm really quite passionate about. So let me just share my screen. So my topic for today is the importance of exercise as a modality for well-being, and the objectives of the disclosure. Disclosure, I have no relevant financial relationships to disclose. I will not be discussing any unlabeled or unapproved use of drugs or products. And the learning objectives of this talk would be to describe exercise as a major pillar of lifestyle medicine, define exercise, types of exercise, and the pillars of fitness, discuss how exercise can reduce the global burden of NCDs, and also outline practical strategies to include exercise into daily life. Now, as I said in my disclosure, I will not be discussing unlabeled or unapproved use of drugs or products, but I will be talking about this very important drug called exercise. As Robert Butler from the National Institute of Aging said, if exercise could be put in a bottle, it would be the strongest medicine that money could buy. Going on to lifestyle medicine is relatively new, but it's one of the fastest growing fields of medicine today. And it's defined by Gary Egger, the author of one of the textbooks of LM, as the application of environmental, behavioral, medical, and motivational principles to the management of lifestyle-related health problems in a clinical or a public health setting. The main pillars of lifestyle medicine that we focus on are nutrition, exercise, sleep, stress, relationships, and freedom from addictions. Other aspects like environment, positive health, spiritual health, etc., can also be woven into lifestyle medicine as and when appropriate for a given situation. Of these, exercise is of great importance, and that's what I'm going to be discussing today. Firstly, we need to differentiate between physical activity and exercise. Activity is any bodily movement produced by the skeletal muscles that results in the expenditure of energy. So it could be anything like walking around, laundry, cleaning the house, shopping, etc. Whereas exercise is the physical activity that is planned, it's structured, it involves repetitive bodily movement involving the large muscles of the body and done to improve or maintain one or more components of physical fitness. The four major pillars are the cardiorespiratory exercise, that is called cardio or aerobic, muscular strength and endurance, flexibility, and body composition, which is essentially a byproduct of exercise, diet, and lifestyle. Now, there are other pillars, the small, called the minor pillars, like agility, power, coordination, balance, reaction time, speed, etc. And all of these can easily be incorporated into a properly designed fitness routine, and they all play important roles, especially as we age. Now, the first pillar, which is cardiorespiratory or otherwise called cardio, is any activity that increases the heart rate and breathing. So it can be anything of your choice, walking, swimming, cycling, dancing, etc. Essentially, it uses the large muscles of the body, requires repetitive movement for a stipulated period of time, and it is evaluated using what we call as the VO2 max, which is the optimum or the maximum rate at which your heart and lungs and muscles can effectively use available oxygen during exercise. This is used as a way of measuring a person's individual aerobic capacity. This is in a lab. But outside of the lab, we assess our aerobic fitness simply by how hard we can work out and evaluate it on what we call the Borg scale that I will be discussing in later slides. Now, there have been a multitude of proven benefits of cardiorespiratory exercise that have been enumerated on this slide. It improves heart health, it improves metabolic health, it improves your brain health, etc. So we need to understand how did these things happen. Now, the heart health, the physiological basis of the benefits of cardiorespiratory exercise is by optimizing the lipid profile, that is increasing HDL and to some extent lowering LDL and triglycerides, which appear to be dose dependent on the exercise. Now, exercise also happens to have a direct relationship on arterial health, arterial wall health, preventing atherosclerosis. Now, even people with symptomatic coronary disease, heart disease, can increase their regular physical activity and improve VO2 max to promote the regression of atherosclerotic lesions. Obviously, it has to be highly personalized and also it has to be supervised. It also optimizes brain health by increasing key molecules like BDNF, IGF-1, which are both neuroprotective. Now, it improves mood by the release of endocannabinoids, especially anandamide, to reduce depression as well as anxiety. It optimizes muscle health either by directly increasing the vascularity of the muscles or releasing cytokines like interleukin 6, 8, 15, increase in lactate, which actually helps in muscle repair, and of course, the reduction in adipose tissue. The second pillar pertains to muscle, and this is actually hugely underestimated and underutilized pillar of fitness. Muscular strength is nothing but the amount of weight that you can lift. Muscle endurance is how many times you can lift that weight without getting exhausted. Strength training results in the increase in muscle size, or otherwise called cross-sectional area, and it leads to the increase in neural adaptation to improve strength. Now, not long ago, muscle building activity, which is known as weight training, was considered mainly to be in the domain of exceptionally strong men who competed in sports like powerlifting, Olympic lifting, and bodybuilding. Now, while it's obvious that these athletes require high levels of strength and muscularity in their particular sports, average individuals, lay people, saw no reason to engage in weight training. And in fact, participants from other sports typically felt that lifting weights could actually hinder their sport. However, now we understand that muscle is more than just physical appearance and aesthetics, and that strength training has several other benefits besides just aesthetics. Now, we can include strength training either by using own body weight, dumbbells, barbells, kettlebells, machines, or TheraBands. There's various ways in which we can actually implement strength training. Essentially, resistance training works by challenging the various muscles beyond their capacity by manipulating intensity, volume, exercise selection, etc. We can actually challenge these muscles and increase what we call as motor unit recruitment, or the number of muscle cells that are brought into play to lift that particular weight, creating mechanical stress and metabolic stress, leading to the hypertrophy or the increase in size. Now, we must remember also that repair, growth, or hypertrophy of these muscles happens during the rest phase, that's between exercise days, and not while actually performing the exercise. This is important because what it essentially means is that we need to allow for adequate rest, that's about 48 hours, before we exercise the same muscle again. Again, the benefits of strength training are many and often underestimated, as people focus mainly on weight on the scale and often cardio rather than strength training. So muscle has a huge number of other benefits besides just the physicality and increase in strength. Having good quality muscle really matters, as it acts as a principal reservoir of amino acids and vital tissues in the absence of adequate nutrition. Important for activities of daily living and, of course, exercise. It acts as a precursor for gluconeogenesis in the liver, helps to maintain protein balance for the tissues like skin, brain, liver, etc. following breakdown, and provides amino acids for wound healing in the absence of adequate intake. Muscle strength and functionality also improve recovery from acute and chronic diseases. Now, muscle also needs to be viewed as a metabolically active, functional endocrine organ. On contraction, muscle-derived factors called myokines are often released that exert beneficial effects on the peripheral as well as remote organs. Myokines like interleukin-6, irisin, myostatin, interleukin-15, BDNF or brain-derived neurotrophic factor, and cathepsin. Now, BDNF, which is the most common and most easily remembered, enhances neuroplasticity and improves cognitive function. Muscle also appears to be connected to longevity. In this study by Srikanthan et al. From the UCLA, demonstrated how quantity of muscle affects longevity. This study found that the total mortality was significantly lower in the fourth quartile of muscle mass index compared to the first quartile. In other words, what it means is mortality was higher in those with a lower muscle mass index, where muscle mass index is nothing but muscle mass divided by height squared. Although the study does not indicate causation and only correlation, it highlights the need to look beyond BMI when we assess the health risk especially for older adults. The third pillar of fitness is flexibility, which is nothing but the ability of the joint to move through its full range of motion, the ability of the muscle to become more elastic. It varies between muscles and between joints. You may find, for instance, that your quadriceps muscle is quite flexible, but hamstrings remain tight, as is often the case. Tightness is in one set of muscles as opposed to the other can actually cause muscle imbalances, poor posture, and pain. Obviously, there are many factors and reasons for reduced range of motion, only one of which is muscle tightness. And this tightness can result from various increase in tension from active or passive mechanisms. Passively, muscles can become shortened by postural adaptation or scarring, whereas actively, muscles can become shortened due to spasm or contraction. Anyway, regardless of the cause of the tightness, it limits the range of motion and may actually create muscle imbalance, which can be countered using stretching. There are different kinds of stretching. The static stretch is when you hold a position for a while, stretching the muscle for a certain length of time. Now, this can be done by oneself or assisted with a partner. When you have a dynamic stretching, by which you move the joint through its range of motion to its end point, yoga, which is extremely popular globally, is a form of stretching, for instance, that can either be dynamic as one moves from one pose to the other, or it can be static when the poses are held for periods of time. Ballistic stretching includes bouncing movement, stretching the muscle a little more each time, but honestly, it's not advocated, especially in beginners, for risk of injury. And then you have therapeutic forms of stretching mechanisms called pre-contraction stretching, which is usually used in physiotherapy to aid in healing and reduce pain. Regular stretching There are many, many benefits like reduction in the risk of injury, greater freedom of movement, correction of muscle imbalances, I already said, by stretching the muscles that are tight and strengthening the opposing muscles, which are usually weak, improves muscle functionality, reduction of pain, enhanced performance, improved blood flow to the particular muscle or joint, stress reduction, and reduction of wear and tear of joints. The fourth pillar is the body composition. Now, we often focus only on weight on the scale, and with that in mind, the body mass index, which takes into account one's height and weight, where BMI is weight in kgs divided by the square of the height in meters. Weight and BMI are standard measures and they're easily reproducible, so it's useful to use to categorize people widely to assess health risk, as seen in this particular chart, using only BMI. Now, globally, anyone with a BMI over 30 is considered obese according to WHO standards. But this value, however, is different for different populations. For instance, in the Indian population, a value between 23 and 24.9 is considered overweight, and a value over 25 is actually considered obese. However, neither weight on the scale nor the BMI gives us actual body composition, which is the ratio of fat and lean body mass or muscle mass, bone, and other parts of the body. Now, this can be evaluated in many ways. The commonly used one is using bioelectrical impedance, using a machine available in most health centers, gyms, etc. Though it's not very accurate, it's very useful to track fat loss or fat gain. Other methods use calipers for the pinch test, which assesses subcutaneous fat and girth using a simple inch tape. Now, all these methods use standard formulae, which can actually be calculated online by entering those values on sites like Body Fat Calculator. The gold standard for calculating body fat is actually hydrostatic weighing, which is used in the lab, where you immerse a person in water and look at the water that is displaced. This is usually used only for research purposes. And then we have the DEXA, or the dual X-ray absorptiometry, which is a quick, pain-free and low radiation scan that can evaluate fat, lean body mass, as well as bone mass. And of course, we have the categorization of fat percentage using this chart. For instance, if you have a fat percentage anywhere between 18 and 24 and you're male, you would fit into the average category. As you improve in fitness, you could lose fat percentage and move into the fitness or the athletic categories. And there is also an essential fat requirement, a baseline, below which, if you go below which, it becomes a health risk. So too low a fat percentage is also not such a good idea. So let's move on to how we actually prescribe exercise. Intensity of cardio is prescribed to a patient using his own subjective experience of exercise, which is called rate of perceived exertion. The talk test is a very simple way to measure relative intensity. In general, if you're doing moderate or even low intensity activity, you can talk but not sing during that particular activity. As your intensity increases, you will not be able to speak whole sentences, perhaps a word or two. You can use the Borg scale, as illustrated here, which is created by Gunnar Borg, a Swedish scientist. It's a simple scale of 1 to 10, or sometimes denoted as 1 to 20, where 1 is rest, like just sitting around, and the degree of difficulty increases, that is breathlessness or increase in heart rate, sweating, and so on, with the increasing numbers. So when you prescribe exercise, you need to explain the scale to the patient and encourage him to stay within the degree of difficulty that's being prescribed. From really easy to somewhat hard for a beginner, encouraging them to go through the exercise routine without too much discomfort. As they get fitter, you can encourage them to move from somewhat hard to quite hard, where they are quite breathless, but not uncomfortably so. An advanced exerciser can be encouraged to push harder and work at a slightly harder level. Now, you can also change up the intensity of cardio for challenge and variety, while too much of long duration cardio, like a marathon, for instance, can actually deplete muscle, which is something that you don't want and you want to prevent at all costs, as I will explain. Longer duration, low intensity cardio is better for beginners. In a systematic review and meta-analysis of interval training versus steady state cardio, Keating et al. Differentiated between SIT, which is sprint interval training, HIIT, which is high intensity interval training, which can be more challenging for more advanced exercisers, as it also prevents muscle loss, and found that HIIT can essentially be very effective for fat loss at a much shorter time, provided the calorie expenditure was matched with the longer duration cardio. And the important advantage was that it prevented loss of muscle mass. Intensity of strength training. How do we assess intensity of strength training? The weight you lift is usually compared to what's called as the 1 repetition max for that exercise. Now, the 1 rep max is the maximum weight that you lift to do a single repetition of that exercise. Now, it's not always tested, especially in beginners, because it can lead to injury. You don't want a beginner to try and lift a really heavy weight. It is hypothecated, however, that if you can lift a certain weight approximately 12 times, where the last 2 repetitions are quite difficult, you are lifting about 70% of your 1 repetition max. So anywhere between 30 to 90% of your rep max can be recommended using different protocols and depending upon the fitness level of the individual. So when we prescribe exercise, we use what we call as the FIT acronym: frequency, intensity, time, and type of exercise. So for instance, for cardio prescription, the WHO as well as the American College of Sports Medicine recommend moderate intensity cardiorespiratory exercise training for 30 minutes or more per day on 5 days a week, for a total of 150 minutes per week of any form of activity of your choice. Now, this is a minimum requirement. Vigorous intensity cardiorespiratory exercise for 20 minutes or more on 3 days a week, approximately 75 minutes, or a combination of moderate and vigorous exercises. Strength training frequency can be recommended on 2 to 3 days per week, addressing all the major muscles at least twice a week. That is chest, shoulders, back, abdomen, hips, legs, arms, etc. Intensity about 8 to 12 repetitions per set, 3 to 4 sets per exercise, depending upon your goals. Type of exercise using either your own body weight, dumbbells, barbells, machines, etc. Time is approximately about 40 to 45 minutes per session. Training protocols really need to be individualized and will also depend upon the time available and the goal. So for instance, you can recommend 4 days a week of 20 minutes if the patient or you yourself find that 40 minutes is too long a time to spend on any given day. Flexibility, frequency at least 2 to 3 times in the week of stretching needs to be implemented. Intensity 30 to 90 seconds up to a point of discomfort, not pain. Time is about 10 to 15 minutes per session. Type, static, dynamic, or neuromuscular stretching. Now, dynamic stretching, mimicking the exercise that is going to be performed. Let's say you're going to do strength training for the upper body. Dynamic stretches for the upper body can be performed prior to the exercise routine itself. So putting it all together, 6 days a week of cardio, at least 30 to 45 minutes, 2 to 3 days a week of strength training, at least 40 minutes, and 2 to 3 days of stretching of about 10 to 15 minutes. Now, despite efforts from many countries to contain NCDs, we know that the incidence of NCDs has been steadily increasing from 61% in 2000 to almost 74% in the year 2019. The WHO's Global Action Plan on Physical Activity of GAPA was put forward in 2018. Now, it includes 20 policy recommendations to help governments tackle the NCDs, the NCD crisis, by fostering active societies, environments, and systems within their nation. According to this WHO, nearly 500 million people worldwide will develop disease due to physical inactivity between 2020 and 2030. Looking at data from 194 countries, WHO estimates that treating new cases of NCDs from inactivity alone will cost the global community almost 27 billion, for a total of 300 billion by 2030. Now, more than 1 in 4 adults and more than 80% of adolescents do not meet the requirements of the WHO recommendation levels for physical activity for optimum health. Over 12 million people across the world suffer from coronary heart disease, which is one of the NCDs, as you know. As far back as 1953, when the famous London bus driver study by Morris et al. Found that drivers who were essentially sedentary through the day had a much higher risk of coronary heart disease when compared to ticket collectors who walks around up and down the double-decker bus all day. We've known that sedentary behavior is an independent risk factor for coronary heart disease, besides health problems like pain, depression, neuropathy, DVT, etc. The global, according to the research from Blair et al. And Masera et al., the relative risk from all-cause mortality and cardiovascular disease mortality is reduced 20 to 35% by exercise and physical activity. Now, despite knowing this, we have, for instance, this paper from your own university and this paper from India, where we find that physical activity for people in these areas is abysmal. In fact, in India, it's even less than 10%. So by and large, what we find is that sedentary behavior seems to be the norm. Now, what are the other NCDs that can be helped by exercise and which are very prevalent in the world today? We have falls, which are the second leading cause of unintended injury worldwide. Now, you may think that a fall is an acute event, so how can it be an NCD? But remember that falls are really a result of long history of loss of muscle, loss of stability, balance, and possibly demineralization of bone, leading to fractures. Each year, huge numbers of individuals die from falls globally, which is over 80% are in the lower and the middle income countries. Now, it's usually adults over 60 years of age who suffer from falls, and 37.3 million falls are severe enough to require medical attention. So falls can be easily prevented and by incorporating the right exercise routine. We can start losing muscle as early as in our 30s, and the process continues relentlessly and accelerates and becomes quite precipitous after 50 years of age. Inactive adults actually experience about 3 to 8% of muscle mass loss per decade. Right, and muscle mass is lost at an even higher rate of 5 to 10% per decade after the age of 50. The ultimate result, of course, is sarcopenia and tophi, which is a syndrome where you are thin on the outside and fat on the inside. So muscle mass is low, but visceral fat is much less. Muscle and bone loss is of particular concern, especially for women of menopausal age, perimenopausal age. As estrogen drops around menopause, both bone and mineral density, mass, and strength decline, leading to falls, injury, morbidity, and of course, increase in mortality. Strength training well before menopause to build a repertoire of muscle mass, as well as increase bone mineral density, is recommended to prevent both sarcopenia as well as osteoporosis, and with that, falls, injury, poor functionality, so on. Diabetes, as we all know, is another non-communicable disease that's highly prevalent. And according to our world in data, 90% of the population between the ages of 20 to 79 in Qatar suffer from diabetes. Adults with diabetes have a 2 to 3-fold increase in heart attacks and strokes, neuropathy, foot ulcers, infection leading to amputation. Diabetic retinopathy is another important cause of blindness and occurs as a result of long-term accumulation of damage to the small blood vessels of the retina. And then, of course, we also find kidney failure resulting from diabetes, poor control of diabetes. People with diabetes are also more likely to have poor outcomes for several infectious diseases, including COVID, as we have seen over the last 2 years. Now, most often when we recommend exercise for a diabetic, the focus is on cardiovascular exercise or cardiorespiratory exercise like walking. While this is certainly an important aspect, we do now recognize that muscle and strength training is important in the management of diabetes. Muscle tissue is the primary site for glucose and triglyceride disposal. So muscle loss increases the risk of glucose intolerance and the associated health issues. Muscle tissue also increases insulin sensitivity, and the more the muscle mass, the better the glucose utilization and better the blood sugar control. In a meta-analysis by Zanuzzo et al. Comparing the various forms of exercise in the treatment of or management of diabetes, from the available evidence, it appears that combining both aerobic training as well as strength training has better results on HbA1c than when compared to either aerobic or strength training alone. Obesity is yet another NCD affecting the global burden of disease. The number of deaths due to obesity has been steadily increasing over the years, and it's certainly a public health problem. And it's also a biopsychosocial issue because weight gain and obesity really doesn't happen in a vacuum. Public policy like food industry, pharma industry, work and family environment, all of these contribute to obesity, and all of them need to be addressed. Now, to add to the confusion, you may remember this article that came out in the Time magazine in 2009 titled "Why Exercise Won't Make You Thin," which was highly misleading. Now, while it's true that if you exercise, let's say for about 30 minutes a day at a moderate pace, you may burn only about 200 calories. And this is easily compensated for if you consume a small cookie. Looking at exercise purely as a way to burn calories to compensate for food is really the wrong way to address the problem of obesity. Weight and, more importantly, health are not purely mathematical models of calories in and calories out, as 200 calories from candy doesn't affect the body in the same way as 200 calories from, let's say, broccoli. Besides, exercise has so many more health benefits, as I've already enumerated, that just calorie burn is really only one of the positive benefits. And the most important is a better frame of mind to continue positive health lifestyle habits. So here's another reason to include strength training into your routine, that is to prevent fat gain, to lose fat, and also to maintain the fat loss while increasing muscle mass. So how does this work? Resting metabolism, or otherwise called basal metabolic rate, or the calories that you burn at rest, accounts for about 65 to 70% of your calorie use among sedentary men and women. An individual with more muscle mass has a higher basal metabolic rate. For instance, a 1 kg increase in trained muscle tissue will increase the resting metabolic rate by about 20 calories a day, which is a large amount when you calculate per year. In other words, a more muscular person is more likely to burn calories even while at rest. So if you see this man's physique, he weighs almost the same in both images, but has distinctly different body composition. He's obviously gained muscle and lost subcutaneous fat in the image on the right. Muscle weighs more than fat, although it occupies less space. So weight on the scale, therefore, really cannot differentiate body composition and can be quite misleading. Cancer is yet another non-communicable disease that's benefited from regular exercise. The beneficial effect of cancer, not only in preventing certain cancers like breast, colorectal, endometrial cancer, and prostate cancer, but also it also improves it decreases the psychological distress from cancer because it improves mood, it improves the quality of life. Obviously, the kind of protocols that are prescribed for cancer patients need to be highly personalized, just like their treatment protocols with medication. Depression is another global health problem, with approximately 280 million people, or 5% of the population, suffering from the disease. Depression can lead to suicide. More women are affected by depression than men. There is an effective treatment for depression, both mild, moderate, as well as severe, and exercise is one of the adjuncts to treatment of depression. Exercise acts as an important adjunct. You can add it to your medication as well as psychotherapy. In a meta-analysis by Schutz et al., 25 RCTs were included in this meta-analysis, and comparing exercise versus control comparison, and found that overall exercise has a large and significant effect on depression. That is, when exercise was added to psychotherapy and medication. Higher physical activity and exercise confer protective effects to depression. How does this happen? People with depression have inflammatory and oxidative stress markers like interleukin 6 and interleukin B. Exercise training is able to promote and increase levels of anti-inflammatory and antioxidant enzymes. This is referred to as a hormesis response. Now, people with depression have decreased levels of BDNF, which actually prevents growth and plasticity of the brain. As already mentioned, exercise increases the mood with the release of the endocannabinoids, and the social aspect of exercise seems to be very beneficial for people with depression. So there's also an increased level of self-confidence and self-esteem in those who exercise regularly. Given the vast body of literature on the beneficial effects of exercise and its undisputed effects on the quality of life, now, what are some of the ways in which we can include exercise into our own lives? Begin with making exercise non-negotiable. Do this first thing in the morning, for instance. Now, when I'm asked what is the best time to exercise, really the answer is whatever time works best for you. But most often I find that those who exercise first thing in the morning and get it out of the way tend to stick with it. And this is until such time when it becomes so habitual that you do it anyway at whatever time that is available to you. You need to add a fun element. It's been found that adding fun really helps you sustain exercise. So things like music, challenges, listening to a podcast, watching a show or news or whatever you enjoy seems to encourage people to exercise. Group sessions with an instructor who is motivating, teaming up with a fitness buddy who can encourage you when you don't feel like exercising and vice versa, including it into your daily activities, like for instance, walking meetings, standing desks, which are now widely available, cycling talks, etc. I intended to use a standing desk today. Unfortunately, that I can't find my standing desk, so I'm also seated. Make it a family affair. Weekends with family could include a walk, trek, or games. Stack your habits, which means link your exercise with a habit that you've already mastered. For instance, walking on your treadmill while watching the 9 o'clock news, which you may be already habituated to, or exercising just before breakfast, using breakfast as the connecting point. There are plenty of YouTube videos with group classes and strength training tutorials that you can use. Ensure that you follow people with good qualifications and who are able to explain the exercises well. But I do advise beginners not to just follow YouTube videos, because as a beginner, you don't really have an idea about what you are doing. You're only watching what the instructor is doing. So for a beginner, I always recommend that they train one-on-one with somebody, with a good qualified trainer, before they start training on their own. Now, with COVID came the onslaught of online exercise classes, personal sessions, group sessions online, etc., which you should really take advantage of. These can be accessed anywhere in the world, and there's really a wide variety to choose from. Join a movement like a walking group or running group. Marathons, for instance, have become really popular these days. While it's great that many people have started running, and most probably do it more for the social aspect than anything else, one must remember that you have to train for events like marathons in order to prevent injury, which could set you back many, many months. Use technology like your watches, your step counters, heart rate monitors, artificial intelligence apps to log in data and assess progress. Almost every smartphone today, for instance, has a step counter at the very least. So please do make use of that. Watches that track sleep, movement, exercise, heart rate, variability, which is an important indicator of health, are all available and can be used very effectively. Personal training, either online or in person, can be a turning point for some people and who need individual attention. So do make use of the available personal trainers. There are several very qualified trainers all across the world. So starting an exercise program can actually be helped greatly by having one-on-one with personal trainers who are good. Now, from a wider perspective, fitness, just like weight loss, doesn't happen in a vacuum. Most people need support. So including a more rigorous medical curriculum on exercise in medical college will actually go a long way in building a physician's confidence in prescribing exercise, influencing policy to include exercise interventions, environmental challenges like walking paths, environmental changes like walking paths, parks, etc., influencing local bodies and organizations to include exercise interventions, training or teaching protocols, making exercise mandatory in schools, colleges, workspaces, a top-down approach in organizations where top-level employees, CEOs, etc., embrace fitness, actually permeates down the line, influencing canteens, restaurants to provide better quality food and make employees more health conscious. The importance of physician influence and prescription on a patient cannot be overemphasized. With exercise as a part of lifestyle medicine, the LM physician always prescribes appropriate exercise schedules or refers the patient to an exercise specialist or an exercise physiologist. So the critical aspect of exercise from a physician perspective is, of course, to walk the talk. The lifestyle medicine is probably the only field that mandates that LM physicians incorporate all the pillars of lifestyle medicine into their lives to the best of their ability. No other field, as far as I know, mandates that the physician experiences what he treats. A cardiologist, for instance, doesn't need to have an MI, or an OBGYN doesn't need to give birth to a baby to be a good cardiologist or an OBGYN. In LM lifestyle medicine, however, unless we as physicians walk the talk, we can hardly be inspiring or motivating for the patient. The first step, therefore, is for us as physicians to incorporate the pillars of lifestyle medicine into our own day. And this way, we will also see the difficulties in staying with a program, for instance, and gain practical experience and thereby have empathy for our patients. Exercise is not easy to embrace or even stay consistent with in healthcare. Having a physician who motivates and encourages you to exercise could be really important for the patient. Now, one of the most important aspects of to consider when we are trying to exercise or trying to start exercise is your why of exercise. So when counseling a patient, for instance, discovering the why of his exercise is more powerful and more important than just informing him of all the reasons that you think he should be exercising. So if on questioning, for instance, he says that he perhaps he wants to travel to see his grandchildren grow up or continue to work effectively, then explaining just how exercise can help keep both his mind and his body functioning optimally will inspire him. In the same way, if you are trying to incorporate exercise into your own life, find your why. Ask yourself what you want from health as you age. What would you like the last decade of your life to look like? Now, this is a good opening question to address. Ask yourself why you would want to live not just long, but that is not just improve longevity, but also improve your health span and live a more healthy life. So before we finish, let's just do a poll to see if, after listening to this presentation, you are able to include exercise more effectively into your day. That's wonderful. So about 40%, 50% are saying they will try and incorporate at least one or two pillars of fitness into my routine. 48 say I will include all the pillars of fitness into my routine. And 55 say I will increase the time and intensity of the fitness routine, which I'm already participating in, and track my body composition. Wonderful. So I've managed to reach at least 50% of you. I hope the other 50% has some food for thought from my talk, and I thank you so much.
And thank you so much, Dr. Nambiar, for that. I think it's been an excellent session, and thank you so much for sharing your expertise with all our attendees today and taking time out from your very busy schedule. So we would like to thank all our attendees who are joining us from different parts of the world, not only Qatar, but we also have attendees from different parts of the world. So I'm grateful to each of them, taking time out to attend this session today.